Good morning, everyone. I am Dr. Kirti Pachisia, and I would like to begin the presentation based on my paper titled Study on Types of Corneal Ulcer in a Tertiary Eye Hospital. The incidence of corneal blindness in India is about 15.4%, and active infectious keratitis contributes to a significant proportion of this. Corneal ulcer would ultimately lead to corneal scarring. This, in turn, would lead to corneal blindness, increasing the visual comorbidity. The data on suppurative keratitis was collected prospectively at Regional Institute of Ophthalmology, Kolkata, in between 1st Jan 2021 to 30th June 2022. 250 patients were enrolled for the study. Corneal ulcer was defined as a loss of the corneal epithelium with underlying stromal infiltration and suppuration associated with signs of inflammation with or without a hypopyon. All patients of keratitis attending RIO-OPD and emergency confirmed of the cause either by clinical examination or investigation who had willingly agreed to take part in the study and had signed proper consent forms were included. Cases which were excluded included patients not certain of regular follow-up, small children, ulcers associated with systemic or autoimmune diseases, and known immunocompromised patients. A standardized form was then completed. Clinical examination was done using a torch and slit lamp. Special attention was paid to fluorescent staining of the ulcer, corneal vascularization, sensations. Amount of hypopyon in the anterior chamber was noted. Corneal scraping was then performed using a sterile Bart-Parker blade under slit lamp magnification. Material was obtained from leading edge and base of the ulcer, was inoculated on appropriate culture media for both bacterial and fungal growth, and was stained with gram stain and 10% KOH mount. If positive for amoebic cyst on KOH, then corneal scraping was performed and the material was inoculated on non-nutrient agar with an overlay of E. coli. These are a few culture plates showing growth of Aspergillus flavus, Bacillus species, Streptococcus and Staphylococcus. Microbial cultures were considered positive if there was growth of the same organism in more than one solid phase media and or confluent growth at the site of inoculation on one solid medium, or growth in one medium consistent with direct microscopic observations as in KOH preparation or gram stain. If by microscopy in KOH, hyphae was observed but it failed to grow in culture, then the causative organism was reported as fungal. Coming to the results, the epidemiological characteristics revealed the following. Keratitis most frequently was found in the age group of 41 to 50 years. Most patients were males and belonged to rural areas. Most of the patients were farmers or agricultural workers, and majority of the patients presented late to our hospital were seen between 2 to 3 weeks of our illness. Distribution of predisposing factors revealed that a history of recent corneal injury was reported in most of the patients, that too with vegetative matter. Some patients had associated systemic comorbidities. Cultures were seen to be positive in about 173 cases, 69.2%. The most commonly isolated bacteria was Staphylococcus aureus, and the most commonly isolated gram-negative organism was Pseudomonas. Amongst the fungal isolates, the 60% of the culture plates showed a growth of Aspergillus, followed by Fusarium. Regarding the discussion, epidemiological characteristics, majority of the patients presenting with corneal ulcer were males. Most common age group was 41 to 50 years, were residents of rural areas and were agricultural workers. Ocular injury was the leading cause of corneal ulcer. All of these findings are similar to other studies conducted in India. Two findings which were significantly different in our study was that 10.8% patients were on topical corticosteroids, which was higher as opposed to other studies, and few patients presented in the first week of their illness. Mostly in our study, patients presented late. Fungi were identified as the principal etiological agent in 43.2% patients, and the most commonly isolated fungal pathogen was Aspergillus. The most commonly isolated bacteria was Staphylococcus aureus. The most commonly isolated gram-negative bacteria was Pseudomonas. A Acanthamoeba infection was found in just one patient who also gave a history of contact lens usage. In conclusion, I would like to say that the incidence of corneal ulcer can be reduced if the predisposing factors can be controlled. Local paramedical and medical people, if trained to manage and identify signs of ulcer, can help in early presentation of these diseases. A community-based awareness program regarding risk factors like trauma to the eye and use of medications without proper prescription may create a difference in overall scenario of ulcer presentation. These are my references. Thank you.
Thank you so much, Dr. Kirti. Thank you so much, Dr. Kirti.